I'm just going to ask each of our colleagues from different countries to talk about what they've been doing on digital and get a sense of the kinds of things that you can do on digital mental health, and then try and get some more shared experience from people in the room. So, over to you. Do you want to introduce yourself? It's being videoed so that we can share it with others, so we can talk to each other, and then as other people come into the room, we'll share some more information.
Thank you. Good evening, everyone. My name is Farjana Sharmin. I'm from Bangladesh. I'm working as a program manager in BRAC, Bangladesh.
Hi, I am Dahildahil. I'm the executive director and co-founder of #MentalHealthPH. So we leverage digital technologies and other innovations to promote and protect mental health in the Philippines.
Thank you. Hello, everyone. Assalamu alaikum. My name is Taha Sabri. I'm the co-founder and CEO of the Kline Health Initiative, which focuses on using digital methodologies for public awareness, offering mental health services, and doing advocacy, conducting advocacy campaigns. So,
Thank you all very much. Roy, you've just held the microphone. Do you want to talk for about 5 minutes about what you've been doing on mental health and digital in Philippines, and kind of what are some of the lessons that other people could learn from that? Over to you.
All right, thank you so much, Sarah. So for our organization, so we started in 2016, and currently we developed like 2 major digital technologies. So one is attached on our social media website, so Facebook, Twitter, and Instagram. Just a quick story. When we started the organization, it's only about awareness, but then when the traction already rise, there are a lot of messages. We're receiving a lot of messages from people who needs help and for people who wants help. And since Mental PH is a volunteer-run organization, we cannot accommodate like enough volunteers to like answer all of those questions. So what we did to address that is we developed a automated menu-based chatbot that is installed in Facebook, Instagram, and on Twitter. So initially we got funding from Twitter International to support the Twitter chatbot. So what it does is it triages messages depending on the need of the person. So if the person needs mental health care, wants to know where's the nearest directory, we can triage it using the app model, menu-based model, and then they get to seek help and reach those contact numbers. So it has no human intervention already. It's open 24/7. It's already launched on the social media campaigns. Then the second app that we developed, it's funded by a government institution. We call it Gabay, or in Tagalog, in English, it means to guide. So it's a mobile health application that helps persons with depression and anxiety in order for them to be able to cope or guide them during those moments. So that's why it's Gabay, because our goal is for people with depression and anxiety to be guided what to do during those important and crisis times.
Thank you. I mean, it's really impressive to think of already you've done 2 apps with major players. You were talking about Facebook and others. So is there anything that you wanted to share as sort of a lesson learned for other people or organizations thinking about developing apps? What was something that you learned that would be good for others to know?
Yeah, maybe important thing that I learned is that digital technology is not an everything. So it's not a end all be all. So it's a way for us, similar that we are understanding mental health in a preventive, promotive, and clinical. We can use digital technology on different levels. So when we use digital technology, it may not always be something that can cure them. It can be just a reference. So you can use digital technologies for references. I love this analogy where they said that digital technology can be a vitamins. So it's something that the people can use every day, but it will not necessarily cure them about the certain illnesses. Or like digital technology can be an antibiotic. You can use it to cure certain diseases, and then after you're cured, you can like let go of that digital technology. Or digital technology can be something on a maintenance level or whenever it's needed. So maybe just to open the discussion, when we figure or develop certain digital technologies, we can explore different ways on how we can use it, and not really just focusing on the preventive or not only focusing on the clinical, but different other opportunities for us to use it.
That's brilliant. Thank you, Roy. I'm going to turn over to Farjana to talk about what's happening in Bangladesh, because you're also developing an app, but perhaps with a slightly different focus.
Thank you, Sarah. From the beginning, we do not have the plan to make the mental health into digitally focused, but we do have plan to integrate the mental health into primary healthcare. BRAC health program is starting work from the beginning of 1971. So we have a community health worker around the Bangladesh. So from 2018, we started to do the digital database system all over the health system in Bangladesh. So in 2021, when we started our mental health intervention, we also trying to make this digitally friendly mental health database, which will be included in the NCD program or other health database. So the main thing or main focus of initiative this mental health database, because we want to integrate mental health into health system, and we will have a holistic database international wise, where we will find a lot of data. We do not want to see mental health in segregated part. We always want to make the mental health as a part of health. So that is the why we are making a database. And also we want to reduce the paper base, like when a para-counselor or community health worker assesses the community member, there are a lot of paper they have to follow, and that is very difficult to maintain that paperwork. So we are trying to do all of things to reduce the paper to digital platform. And Bangladesh government also having the vision to make the health system digitally. So that's why we BRAC as a partner and government also aligned with this kind of initiative, and we are trying to integrate the mental health into primary healthcare in digital way or smart way. Thank you.
Thank you. So this is a very different use of digital technology. What we're talking about here is how do you use digital technology for health systems? How do you capture information and then use that to plan better health systems? And is there something that you've learned from, you've been working with the government on this, that's a big job, trying to get the government, a government of a large country like Bangladesh. So are there any lessons that you've learned about trying to improve digital health information?
In terms of mental health, it's itself a new area, whether you're working on any country. So government has been supporting from the beginning of our intervention. They also provide their point of view. Like we continuously developing our data system. Like last week we have a meeting with the Non-Communicable Disease Control Program, Ministry of Health and Family Welfare. So the line director, Dr. Robid Amin sir, has suggested her point of view, like you can improvise something. So they have the planning to integrate this digital platform into the national level. So I think we are learning by doing, like a lot of things have still work on in future. So this is how it's happening.
It's really exciting. I think for a lot of people, one of the main problems, and we talked about this already, is mental health data. So the idea that you can get digital data and then you can look, I've seen it on your phone, about what the data is around mental health is just so impressive for a country like Bangladesh, so big, such a diverse population. So I can see, what do you want to show? You're going to show.
Sure.
There it is. You have to wave it. We'll have to have a look later.
This is on my this is on my phone. I can see my data in anywhere. So this is the, as I say, we have the community health work and the para-counsel who are solely working in the mental health intervention. So I can see how many cases they have been providing the services and what is the number of adults and the child. And male-female ratio and where the client came from. And a specific ratio. Then the community-based, what is the happening in the community level? What is the symptom is for adult and the child? That's also we can see, and also we can see the urban and rural area presentation in this data system. And also we try to link with the tertiary level, like community level in Bangladesh, there is no intervention. BRAC has started to intervene in the community level. So there is a gap between tertiary level and the community level. So in our data system, we can see the linkage between tertiary level and the community level, and we can find the data where the client is going. And also we can see the outcome, like after our intervention, how many % tests of Kline have been improved or there is no improvement. That's kind of thing we also can see from this database. And also we can see if you want to monitor the any digital platform has the focus on the monitor the intervention, right? So is the community health worker or the paracounselor, I want to see the is they are working, is they are fulfilling their target. So I can individually follow up the counselor, paracounselor, or the community health worker from this database.
Thank you. So please come over and see the phone later if you'd like to learn more about digital health systems. I'm going to turn over to Taha from Pakistan, who's also been looking at digital. Again, Pakistan's a very big country, large population, lot of needs. Can you explain a bit about what you've been doing?
Sure. So, Sarah, when we started working out, it was a traditional approach, a community-based approach, going in schools, going in low-income communities, giving workshops. But we realized quickly that the scale of the crisis and the resources required were not enough to really reach as many people. Like, for example, in the first year, we provided intervention to around, let's say, 500 people, yeah? So then we decided to take a strategic shift, and the limited resources we had to invest it more towards social and mass media awareness. At that time, there were we didn't have a lot of examples. There was a Time to Change campaign going on in the UK, which hadn't completed its impact evaluation yet, but it was still something, that was the only thing that was there. So then what we did was that we brought on board artists and people who work in theater, filmmakers, and we gave them a brief, like these are the key messages that we want to provide. And then they developed these short films around mental health, and which were very, very impactful. Like some of our videos have reached around 2 to 3 million people, right? And at a very paltry sort of investment of like, let's say, $1,000, yeah, the cost of a video. And that's when we realized the power of social media. At the same time, then we also started going to mass media. We also realized that we could, if we could make mental health a fashionable topic, then perhaps mass media will pick it up as well. And then we created a methodology in which we started focusing on social issues and linking it with mental health. For example, domestic violence and linking it to mental health. Or let's say, harassment of women and linking it to mental health. Or financial problems and linking it to mental health. So those kind of issues, so indirectly talking about mental health, so that mass media picked it up, and then we were working with more than 8 TV channels, doing weekly shows with them. Those channels are still continuing mental health shows now without us as well, because they get good ratings from that. And of course, teaching them the ethics of how to report, how to talk about it, without further stigmatizing the issue. So this was a bit of the digital interventions in our awareness part. Then when it came to mental health services, so when we started thinking about, when people started coming to us and we started referring them out to other providers, there was a challenge in that the services were not accessible. So then we started telephonic mental health services, offering counseling, psychotherapy, psychiatric support via telephone. But what we realized was that another issue was that people contacting us, so it took us, because there was so much burden, it took us almost 48 hours to respond to them, yeah? And we were missing a lot of suicide cases because of that. That's when we decided to delve into artificial intelligence and machine learning. And we partnered with WhatsApp. WhatsApp gave us a grant to develop a WhatsApp-based chatbot, which is now active. The chatbot does mental health screening, severity assessment, and books an appointment of the patient with our helpline based on their severity. If it's suicidal, same day. If it's not, then the next available appointment. Similarly, we also started delving into seeing what else we could do with artificial intelligence. And we developed a psychoeducation-based chatbot, which now we're going to start rolling out to schools. 1 million children can use a chatbot at one point in time, and there's no additional cost. So that's another avenue we're looking into. In addition, now we're also looking into that how can we make the treatment process more intuitive. So now what we're trying to do is to create another an app which the patients who are utilizing our services can then utilize that app to get guided coping skills, right? So for example, a therapist gives a patient a deep breathing exercise to do. So the chatbot on the app guides the patient through it and takes notes as well, which it feeds back to the therapist. So in a way, like making the therapy, of course, the artificial intelligence cannot replace the human touch, but they can perhaps reduce the number of consultations required, and thereby increasing our capacity to deal with more people. Yeah. So those are some things which now we're working on, and we'll be happy to share with others who are interested. Yeah.
Thanks so much, Taha. Taha's covered a lot, so thinking about communications and social media, but then going right through to apps and how apps can actually support and augment what could be done on a therapeutic basis. I'm going to reach out to the audience because we've got quite a few different people here from different countries. Lots of questions. Okay, I'm coming. This is like TV chat show kind of thing. Over to you.
Hi.
I don't think I'll just let the camera move towards you, but go right ahead.
Okay. Farhan Yusuf from Tanzania. Thank you for that. I guess, you know, I have two questions. Number one is when you're talking about especially using digital for mental health awareness, etc., how do you measure impact? Because I think that's something that keeps coming up. Is it just the number of eyeballs that are, you know, watching your information? Like, how do we create sort of monitoring and evaluation systems to be able to check for impact, especially for the awareness bit? But then the other thing is, you know, when you're talking about setting up helplines and all of that, I think one aspect that we don't usually hear enough about is what sort of legal framework does a country need to have? And is that something that, you know, advocates from different countries need to keep in mind? And how did you navigate that space? Like, is it okay for, you know, someone to provide counseling over a phone call? How did you sort of navigate that space?
Thank you. I think those are two really great questions. Roy, do you want to start and then we'll come to Taha?
Okay. So for the first part on the awareness building, there are different monitoring and evaluation tool that you can use, or somehow just to have a proxy data that you feel that it's working. So on our end, what we're doing is on the reach and engagements. So in terms of promotion and awareness, what we want to measure is how many people have interacted and participated in that conversation and participated in that topics. And then internally, somehow, one of the metrics that we are also measuring is how many of those who are aware translated to advocates, translated to actual service use. If it's possible in your country where you can link when you can get data from the clinics, the clinic was able to increase in terms of service users because of your application, then maybe you can correlate that. Unfortunately for us, we're not able to reach that, but the goal for us is to have that through our directory. So we're eyeing to have that kind of monitor evaluation. So it's not, I think the bottom line is it should not end only on awareness. We have to make sure that after the awareness, it translates to positive, healthy practice. So one would be possibly taking care of themselves and seeking professional help, or another is making a proactive journey in terms of the mental health sphere.
Yeah. So just to add to what Roy said, that so social media provides very robust metrics. Yeah. So with Facebook, Instagram, you know that how many people have it's reached, how many people have viewed it, and how many people have viewed it for how long, right? So 3-second views don't really count of a video, yeah? But you can see how many people viewed it till completion, which shows, okay, if they were interested, and how many people shared that video, yeah? So those are some ways that you can assess the impact. And then, of course, also to see, like, for example, on our helpline, we sort of try to analyze that what are the referral channels people are coming from. So for example, like 40% come through Facebook marketing, 20% come through Instagram, right? 20% come through community-based channels. So that's how we also measure, okay, fine, we have a campaign going on. So for example, if you have a postpartum depression campaign going on, then we see in that week, a lot of patients are coming with postpartum depression. So that's how you actually can measure. Another way that we've also done this is that we started screening our videos in primary care centers. Because low-income communities, we cannot reach through social media. So, but in primary care centers, you just put in a screen, you put in the videos on a loop. So whichever people are sitting in the waiting areas, They're seeing those videos. And then you can conduct impact evaluation. So we do random samples, and we ask a couple of questions. And that's how we understand that how has it led to changes in knowledge, attitudes, and practices and all. So that's another way of measuring. As far as the legal aspect goes, so in Pakistan, there was no legal kind of landscape for digital services when we started. So that was very advantageous because we could do whatever we want. But that also led to a multiplicity of helplines which were harmful, which were not effective. So it's a double-edged sword. Like having too much regulation can stymie, but having too less can also lead to unethical practices. Yeah. So you have to see within your national context, and of course, if there's no legal sort of thing, then you have to self-regulate, hold yourself accountable, and until there is a sort of legal framework to support. Yeah.
Well, that's amazing work for three of you. Thank you very much for. I'm sorry. Yeah. Thank you very much for sharing. I'm really looking forward to know more about your solutions. In Brazil, we just launched the Center for Innovation Research in Mental Health. And actually, our key objective, despite developing, is validating solutions. So is how can we implement a specific framework in terms of evaluating the impact, evaluating the clinical impact, evaluating the user experience, the security, the interoperability. So are you guys evaluating, implementing this kind of validation into your solutions?
Okay. Okay. Yeah. So impact evaluation is critical for these solutions, and the different ways that you can build it in. So for example, with social media, if you're producing, like we produce a lot of video content, a lot of short videos. So then we also establish benchmarks, right? So if this video performed this well, so now this is our benchmark. And then you measure the other sort of campaigns with that. Did this campaign achieve as much traction? Why not? Then doing a user analysis. Then also doing a thematic analysis of, let's say, what kind of comments are coming, right? So for example, some videos we got some negative feedback from people. So why, and that's not necessarily bad because it's challenging social norms as well, yeah? Because we're challenging culture when it comes to some cultural things like that. So bad feedback doesn't necessarily mean that it's a bad thing, but you have to just, it just depends on the context and all as well. So yeah.
I think I understand where you're coming from because a lot of mobile applications currently in the market have no monitoring evaluation tool or like a research component where did it really improve the well-being of the person or well-being of whoever uses it. So on our project, the government-funded project, we designed the mobile application to have a sort of randomized control trial. So currently, we still don't have the results yet. We're still in the data gathering stage, but we have selected people then performing using the application and then without the application, and then what they wanted to our goal is to really compare in terms of well-being, did the app really improve or not improve, in order for us to provide more tangible and research or evidence-based information. And this mental health application developed by this organization, we're able to like improve the well-being of the person by this amount. Yeah,
that's just amazing. Just one aspect that we are currently working with. Sometimes implementing RCT to evaluate a digital solution be quite challenging. So one perspective that we are currently developing is more pragmatic trials, so in which we can evaluate the effective impact in real case scenarios. So it would be amazing. Yeah.
Thank you.
Yeah.
But I'm going to need to get round to a few more questions. That's okay. There's a question towards the back. Ives will get you the microphone.
Sorry.
Hi, sorry. Thank you so much for your discussion. Super interesting. My name is Jana from Y Labs. I'm just a question about scaling. We had a pilot digital mental health intervention that was focusing on literacy for young people, co-designed with young people, based in Rwanda with an offline component. So we trained up youth as wellness warriors to deliver, to sort of facilitate workshops using this digital tool that we designed. We've evaluated the intervention. It's successful in terms of like reducing depression, anxiety, stigma, etc. But I was just my question is around scale up, because we're now we have proof of concept. We're thinking about the next stage and scaling up. And I was just reflecting on, we had a conversation about scale up of interventions yesterday, and I was wondering, do you see any, what are the challenges in your opinions about scaling up specifically within the context of digital mental health interventions, and how would you, suggest overcoming some of the main challenges?
This is the burning question we have our mind too. So initially we are, any pilot project is easy to administrate, like in perspective of intervening or monitoring or evaluation, doing research. Any pilot study or any intervention is easy to do. But when we think about the scale up, there is a lot of challenges. There is limitation of resources, funding. Many things have to be keeping in mind. And we also thinking about, like, when we try to fit in, when we are talking about the scaling up, we need to have the structure or mapping of the national-wise, right? So in different area, any country have different structure in terms of health system. So when we were thinking about the scaling up, we need to keep in this mind and how it will link with existing piloting intervention. So before doing any scale-up intervention, I think we need to do a research and try to test it in different area where there is no facilities or there is no structure. So from the experience or from the data of the research, we can find the solution. And of course, we need to have the other stakeholder, not only the government, also we have to find the other stakeholder who can help us in scaling up process, because when you do think about the scaling up, you can't do it alone. So you need a team member, right? So when you think about the scaling up, we need to pre-think about what we need to do right now, and who are the stakeholders who are going to help us, and what are the resources we need to, and if there is any technical aspect we need to build up, so it should be thinking about right now. Thank you.
Thank you. So that's a lot about kind of planning. I want to get a show of hands about how many more questions we have. Yeah, we'll just go to that one and then can come back and answer a few points.
Thank you. My question, I want to know what data protection policies do you put in place, especially when you're seeking for funding, where the donors or funders would want to have an evidence-based fact of what you have. How do you make sure that those who sign up for these digital apps, their data are not actually given out?
Yeah, so what data do you need in order to fundraise for an app?
So let's assume that I have a Facebook page or an app where people sign in to seek psychotherapy, and I need funding. And the donor is saying that, okay, show me what you have. Show me, let me get the clients or perhaps your people that you've had sessions with. Then I can give you some funding. How do you engage that kind of conversation with
Okay, I'm going to ask Roy and Taha to answer that. So, and then maybe to come back to the point about scale up. So starting with, how do you raise money and how do you deal with the chicken and egg about how you start an app? And then secondly, that maybe to answer the other point about fundraising, about scale. Go for it, Roy. And then.
Yeah, I think I'd just like to answer on the terms of data. Since our mobile application, it was funded and ethics reviewed. So when we recruited participants, so we were still in the phase, we're still recruiting select participants. So when we recruited them, we informed them of the data that we are collecting and then what we are going to do with the data, and for them to be able to give consent. So currently we are still on that stage, and we are guided with the Data Privacy Act and by the Philippines. So I think if we are going to do digital technology, we also have to landscape review what is the available policy that should guide in terms of data collection, in terms of data processing, and align it with the ethics review also that we need to follow in order to develop digital technology.
So it's tough because So digital methodologies are fairly new, right? And funders don't have the, what we experienced initially was that funders don't have the framework to essentially analyze their effectiveness initially. Because usually the funding has been for community-based intervention, so you have those kind of frameworks. And with digital methodologies, what the trick is that it's like, in a way, convenient sampling. Yeah, in a way, it's not random sampling. Only people who are on social media, who your page reaches. So there are a few methodological limitations. But essentially, I think how we do it, because we do now get funding for digital solutions. We get grants for that. Like the Vitol Foundation is funding one of our public awareness programs as well. And so we pre-establish certain metrics, yeah? And the key metric is that conversion to help-seeking behaviors, because that is what, that is the end result of stigma. This is help-seeking. So help-seeking is like the main sort of, we have other metrics as well, but it needs to be an awareness sort of intervention, needs to be connected to a mental health service, either within the organization or referred. And you need to have data how many people came to that service. So that really shows that is the objective being achieved, is the behavior change being achieved, which is destigmatization and seeking help. As far as scale-up goes, I think, so for scale-up, what needs to be understood is the 80-20 principle, which we talk about, yeah? So whenever you scale up a digital solution, you have to culturally adapt it a bit based on the region, because usually you do a pilot in a particular region with a particular cultural context. And when you scale up, so the 80% will remain the same, but 20% will be a bit different. So for example, what we started is animated series, an animated video series, educating people about mental health. But we've made it in such a way that it can be dubbed in different languages. So for example, you make it extremely visual, and then you dub it in regional languages as well, and adding those regional nuances, those cultural nuances, to make it resonate more. Because the thing with awareness and communication is about really resonating with the audience, resonating with their cultural and life experiences. And for that, a lot of, you need to do some anthropological work as well, to understand how the cultural conceptualizations of distress and human consciousness, and then tailor your content to that. But 80% will usually remain the same, 20% will be a bit different when you scale up. So that's what we've learned through our experience.
Any other questions? Hang on a second. We'll just get you the microphone. Thank you.
I'm from Joburg. Just in terms of the chatbot, is it using these sort of large language AIs where you are generating very kind of almost intimate responses rather than standard set replies, where the, for example, Snapchat now has an AI embedded that you can talk to day and night to. That's not very good for children's mental health, frankly. But does it use similar technology to compete with the likes of Snapchat?
Thank you. Roy and then Taha.
I think Taha and I are using a different style of chatbot. So our chatbot is menu-based chatbot. So it means that we pre-identified the responses and the path and the entire conversation flow. So we did it that way because we want to ensure that we sort of control the environment, and we will be able to provide with appropriate care and be able to triage them to the proper resources. But I think Taha have a different experience.
So we initially try to do a sort of, use machine learning, yeah? We initially try to make the chatbot responses customized to the query. But the problem is, what we found out is that you can code cognitive intelligence into a machine, but you cannot code emotional intelligence, yeah? So that's a big sort of limitation when it comes to chatbots, because a lot of the treatment process requires emotional intelligence more than cognitive, and that emotional social intelligence is based through life experiences. It's difficult to code that in, right? So then we found out it wasn't possible without having a lot of resources, like because we need to feed in a lot of data to achieve that state, and we didn't have those resources, especially in low-income country. So then we stuck with pre-form responses, but we did a hybrid model. So instead of just like them selecting options, some questions are open-ended, like how are you feeling? Yeah. So then they can be given open-ended response, even though the response of the chatbot would be the same. But also, like, during the process of building the chatbot, we did a lot of A/B testing, and what we learned about that Murphy's law applies to this. That anything that can go wrong will go wrong, because people start also trolling to see that if it works or not. And if you don't code the chatbot to preempt the trolling, then it gets stuck, and then people criticize. So you have to, like, every single response, you're saying, okay, fine, if someone responds the correct response, that's fine, but you think more about the incorrect responses to preempt them and ensure that the chatbot does not get confused and can still go on answering those questions in a flow. So it took us like 3 to 4 months before we perfected the WhatsApp chatbot, and it's a very simple chatbot. But for the therapy one, we are going to use more machine learning algorithms, like some simple things, like if someone responds, so what are you experiencing? So if someone says, I'm experiencing problems with my wife. Someone says, I'm experiencing problems in my studies. Someone says, I'm experiencing problems in, let's say, related to my identity, right? So the chatbot should be able to read, okay, fine, this is relationship problems. Let me start the relationship problem script. Or this is like gender problems, let me start the gender problem script. So at that level, you can still code it, like use machine learning. But beyond that, because of the fact that human beings have still not understood our emotional intelligence completely, it's difficult to code it into a machine. So yeah.
Thank you. I'm going to need to close the session here, but in one sentence for a tweet, what's the future for digital mental health?
From BRAC perspective, we are thinking about to make a national-based database where we can find what is happening in the community level, because we have limited data for mental health aspect. So I think it will help.
Yeah. I think going digital is inevitable, so we really have to prepare and equip ourselves in order to be able to adapt in that new landscape.
Thank you. So community-based mental health data and going digital is inevitable. Taha?
So for me, digital solutions in mental health can ensure greater equity and prove to be the great equalizer in accessing mental health services.
Thank you. There you go. Some really helpful insights. Thank you all very much.